So how are local officials looking to stop this epidemic?
Erie County has been recognized for its comprehensive approach, but could some additional strategies be more effective? Channel 2's Ron Plants asked the county's chief medical officer what more can be done as we hold people in power accountable tonight.
This is still one of the primary methods to combat our still surging opioid epidemic. An information and training session in a Buffalo church basement run by the Erie County Health Department to also knock down the stigma of addiction that it can happen to anyone, anywhere.
The way we can really fight this epidemic is to get the whole community involved, not just people who's been impacted by this.
And continuing demonstrations on the use of Narcan or naloxone are paying off and saving lives. For example, 2,500 people have been trained, and they have the numbers strictly from the city of Buffalo first responders so far this year.
They've had over 1,400 saves for naloxone. So you can imagine that probably for every overdose death, there are probably 3 to 5 naloxone saves.
Burstein also says more calls are coming into the county's addiction hotline for help, seemingly positive moves, but
is there anything else, though, that's kind of you think we could be doing? That
yes.
Go ahead,
yes.
fire away.
I mean, our opioid task force is not a stagnant group.
And the outreach is going after the white coats, with more doctors writing less prescriptions for opioid painkillers, suggesting more common over-the-counter painkillers like ibuprofen. But for those who are really addicted, also reaching directly into the hospital emergency departments.
We're working with our ED providers to hopefully be able to get them certified so they can start people who are coming in for an opioid-related complication on buprenorphine.
That's the effective addiction treatment medication, also known as Suboxone, for which doctors have had limited prescription access. Still, Dr. Burstein says despite some recent progress, the opioid addiction crisis could easily last another 10 to 20 years.
The only numbers we know are the tip of the iceberg of our overdose deaths, but we know that there are so many people who are struggling with addiction. Some of those are in care, but we know many of them are not in care.
Okay, our overdose numbers are disturbing. We'll get some perspective here. Some say Ohio is ground zero for the country's opioid epidemic because of the more powerful fentanyl there. That's the deadly synthetic killer that Steve mentioned. Now, Cleveland, obviously a larger metro of over 1 million people. But Dr. Burstein says they have had 600 overdoses and expect many more. We are not alone in this. Ron Plants, Channel 2 News.